Well, to look at yet another eventful and, truth be told, worrisome week as two of the country's most populous provinces plunged into the second wave of the coronavirus pandemic, and as BC and Alberta are following. To look at it all, I'm joined now by Robert Benzie. He's a political reporter for the Toronto Star, and he joins us from Toronto. Niigan Sinclair is a professor, writer, and commentator. He's joining us from Winnipeg. And Marieke Walsh is a national political reporter for the Globe and Mail, and she's here in Ottawa. All three of you, thanks for taking the time.
Hey guys.
Listen, let's start with, because Robert, we've been watching in Toronto, there are a lot of announcements being made today by Premier Ford, obviously record numbers in Quebec and Ontario today, but Premier Ford was announcing a crackdown in certain measures and also regarding testing. But at the same time, a lot of the reporters' questions were whether he was going far enough. How would you evaluate what's happening in your neck of the woods?
I mean, the situation is really fluid, Martin. And at the end of the day, Ontario is facing a challenge in three areas: Ottawa, Toronto, and Peel Region in the suburbs of Toronto. The rest of the province is in fairly good shape. But today we had, more than 730 new cases. It's a record in one day. Now, part of that was because of some data collection issues that they've had. But it's also a worrying trend because they've said, if we get to 1,000 infections a day, then they're going to have to start shutting down more of the economy. Now, they don't want to do that yet, and that's why I think some people were saying to Premier Ford today that the measures he took, including basically bringing the rest of the province up to the Toronto standard for masks. You have to wear a mask when you go anywhere inside that's a public place. Now you have to wear a mask if you're outside and you can't be socially distanced from people more than 2 meters apart. And on the testing, with a huge backlog of testing, 90,000 tests waiting to be processed, the government is now limiting tests in the sense that you have to make an appointment, and that will be one way to be a bit of a bottleneck. Now that's going to create its own set of problems, because if you think you have COVID-19 and then you're on hold for an hour and a half and you can't get an appointment for a month, what happens then? So the situation's moving very, very quickly. There's a lot of criticism, obviously, of the government at Queen's Park, as there should be, because we've had a lot of time to prepare for a second wave, and I think that there's concern that we haven't done enough or didn't do enough in the summer to get ready for this.
Okay, Marieke, I want to look at the federal level in Ottawa. When you look at what's happening in Ontario and Quebec, but also what's happening in other places, but Ontario and Quebec being the most acute, what's your sense and what's your evaluation of what's going on in terms of the federal level? I mean, there's so many different fronts, but I mean, weigh in on that.
Yeah, I mean, I think that the feds are in some ways trying to figure out how they can play a role in dealing with these issues that are so predominantly a provincial jurisdiction, a provincial matter of education and healthcare. And so what we're seeing, for example, is Ottawa today announcing more money to support businesses and to try and bolster the economy as the province trying to manage their healthcare fronts. The government's trying to, I think, backstop the economy, but there's still lots of questions around those programs. For example, there's been no replacement yet for that rent program for businesses that are struggling. And that, if we do see more closures or we do see a limit to dining inside, all those things are going to hurt revenues even more. So I think there's a lot more for Ottawa to answer to on that front, but we've seen those moves today, and again, new changes on the border with who's allowed in and compassionate leave to allow more people in. So that's how Ottawa is responding. But I think for Canadians, for people watching our different levels of government respond, when you're seeing the local health officials kind of ring the alarm in a really serious way in Ottawa and Toronto today, and then having a much more muted response or reaction from the Premier and the federal level, it is kind of hard to process exactly what matters and who's doing what, and why it's such a serious issue at the local level, but then the response seems much more low-key.
Niigan Sinclair, in Manitoba, obviously there's not the acute crisis that the acute nature we're seeing in Ontario and Quebec, and to a certain extent in Alberta and BC. Give us a sense of Manitoba, though, what's happening and what the state of the pandemic is in Manitoba.
Well, I mean, for weeks, months actually, for the pandemic, Manitoba was relatively unscathed. We were at the similar amount of cases as New Brunswick, and much, of course, smaller geographical mass, much smaller population base. And then almost immediately, as soon as the openings, the lockdown was removed, openings began, public spaces were opened. Then we turned from one of the best cases in the country to one of the worst in terms of proportional. Proportionally, we've been leading for weeks now in the rest of the country in cases per day per proportional representation to population. And really seeing that is we're seeing that so in many ways, Manitoba's going through its first wave right now. Others may be going through their second, but we're right now in our first. Okay. And the most interesting thing too is happening on First Nations. On First Nations in northern Manitoba, we're seeing a huge rise in cases involving Winnipeg, people who are coming to Winnipeg often for testing or visiting or groceries, which are as a necessity in First Nations communities, and then bringing that back to their community. Taskawayak, Pimachikamak, Peguis First Nation, they all showed cases in the past 10 days. And the problem, of course, when it enters into a First Nation, it's going to spread faster due to the lack of health resources, overcrowding in houses, the lack of adequate sanitation. It's going to go faster. And just like we saw during the 1919 Spanish flu, First Nations were hit months after everybody else, but it was way more devastating.
Well, I was going to ask you about that because, I mean, until now, when we watch federal briefings, for example, the federal Indigenous Services Minister and all the deputy ministers have been saying until recently that things had been going relatively well in those isolated First Nations communities across the country. But you're saying that we're now seeing a worrying change in that.
It may have been in terms of active cases on First Nations, but urban Indigenous communities have been seeing a high impact, particularly those in poverty situations. So those are the ones who are at the front lines, because we know geographically that COVID-19 impacts Black communities, Indigenous communities, and poor communities. And sometimes Indigenous peoples are all three. And so the Indigenous communities in the urban spaces are affected most, but really the real epidemic of this pandemic has been mental health. The situations involving overdoses, situations involving the lack of resources, and of course the situation involving racism of Indigenous peoples in the healthcare system has resulted in a huge pandemic or an epidemic of violence in Indigenous communities, often in suicides, or as we saw in Quebec, deaths when you enter into a health facility.
Yeah, I want to ask then, and this is a question, I mean, it's a question we ask every week, and it's a second, but the biggest question, that is, what are you watching for then in your different venues and in your different responsibilities? What are you watching for as the biggest challenges as we enter this next week of the pandemic? I'll start with you, Robert.
Well, I'm watching for the pressure that is building on the government to shut down the economy again, and they really don't want to do that because the mental health toll that takes, not just the economic toll of shutting businesses down and people being out of work, but the mental health aspect of not seeing people and not seeing friends and not being able to socialize, even safely with social distancing. That's something I'm going to be watching for. I'm also going to be watching for this continued kind of evolution of a plan. I mean, in Ontario, they seemed on top of things in sort of late July, early August, and it's just been kind of, I don't want to say downhill from there, but it's certainly been evolving in a way that is not necessarily good for the government or necessarily good for the people. And I think everyone shares these concerns. This is not a particularly partisan thing, a partisan time in the sense that, Stephen Del Duca, the Liberal leader here in Ontario, was saying today, encouraging the Premier to shut down the economy. The Premier, ironically, is hearing from his own caucus members, some more on the right in the Conservative caucus at Queen's Park, who don't want him to even do what he's doing right now with mandatory masks and so on. So there's a really delicate balance for these guys, and the pulling and pushing is tricky.
Marieke, you kind of referred to it on the federal level in the sense that it's a federal government searching for a way to find out how they can help. I mean, the pressure, for example, on testing in the throne speech, there was a commitment to, we will be there to backstop you on X, Y, and Z, and yet the crisis continues to build. What are you watching for?
Well, I think we have to see how those promises, like the rapid response team that the federal government promised in these kinds of situations that we're seeing in Ottawa and in Toronto, when Ontario has 92,000 cases in backlog to be tested. Those kinds of questions. Okay, so Ottawa has promised these response teams. How does that actually work in practice? Will it work in practice? So that's one thing. The other thing is how Ottawa and the premiers continue to work together, because I think we saw after the throne speech some shakiness on that front. There was, a truce for quite some time between the mostly conservative premiers and the Liberal government here in Ottawa, and that seems to be more on shaky ground, I think, as pressure mounts on
Yeah.
all fronts. So I think that's another thing to look forward to. Really, though, for Ottawa, it's going to be the fiscal update. It's going to be what measures they actually put in place, what things they actually prioritize by amounts of money spent and by timelines that we'll really see how they're planning this going forward.
Okay, just a last word too. We're almost out of time, but Niigan, what would you be watching for in Manitoba?
Well, there's an ongoing struggle, of course, this gap that we've identified between the provinces and the federal government, and it came out in the throne speech. The throne speech is all about provincial jurisdiction, but really the federal government has no control over that. But what we're seeing that on the ground level is the stress on provincial services that disenfranchised communities who are most impacted by the pandemic are placing. That's on things like health services, that's on police, that's on social services, child welfare particularly. And so what you're seeing is this really burgeoning conflict in cities across the country between Black, Indigenous, poor communities and provincial services, local services, that is really resulting in a very difficult situation.
Okay, well, all three of you, I want to thank you very much. We'll keep in touch and we'll keep watching this. And obviously, something that it's hard to change the subject and look at anything else these days. It's the one subject that dominates everything. Thanks, all three of you.
Thanks, Martin.